Sophia, what are your experience in actually getting patients familiar with new tools in healthcare?
So I mean, in general?
In general, and as well with CRUSE.
Yeah, I mean, I've got pretty much the same experiences as Marcus. It depends, of course, on the age. But as Marcus said, sometimes even older people, as they're more excited even to check how those apps are working. Yeah, and then they have even fun doing it. So that's also an advantage. It was also quite funny. I met a colleague at a conference in Madrid a couple of months ago, and at some point I said, "Yeah, we are doing CRUSE, this app for chronic spontaneous urticaria patients." And he said, "Oh yeah, CRUSE, I know that." And I was like, "Yeah, how do you know it?" And he was like, "Yeah, he got an urticaria patient coming in, and normally they fill out their questionnaires that we talked about, these prompts in the waiting room." And so he said, "Yeah, can you please hand me over your those questionnaires," because he then calculates it. And the patient was, "No, I've got the CRUSE app." And so that's how my colleague got to know this app. And so this, if you're a patient, you can also tell your dermatologist, your allergologist about CRUSE, and the same with other health applications. Just give it a try, start using them, and yeah, I think that's the way to go.
Exactly, and this is not rocket science. Those apps are pretty intuitive, wherever age you are, and this is very, user friendly. That's the goal, to keep people engaged. Marcus has briefly mentioned clinical studies, right? That also these type of apps and in general, digitalization in healthcare do have high impact on running clinical studies. So how did this field change in terms of actually providing more digital tools for our patients and physicians? You have been doing this for a while, so you definitely know the change in that.
Sure. Look, Aiste, we're very active in supporting partners who develop better treatment options for patients with urticaria. And what do you do to do that? You run clinical trials, and they can be quite sophisticated with different groups of patients who are being compared for their response to different treatments, either different doses or placebo and so on. So running clinical trials in chronic urticaria is quite challenging. And it has something also to do, again, with how do we measure the response to treatment? Because in the end, we want to know, is a new treatment under development better than what we have today? How fast is the onset of the benefit that patients have? How long does it last? So again, patients need to let us know how they do in these clinical trials. And back in the old days, we really had big books where patients every day got a new page and they had to put in what is their disease activity and so on. And over the last 10 years, this has changed quite a bit. First with special devices, handhelds, where they would get for the duration of the study an extra phone, so to speak. It wasn't really a phone, but it was like a little mini computer that they used to enter their disease activity every day. And no one was excited about that, because now you need to carry that second box around. You already have a phone and you don't want, as a patient, to have another one. So more and more, these clinical trials are being done with programs that patients can access from or download to their own phone. And that's great. No, it makes it simple, makes it easy for patients to document. And that brings me now back to CRUSE. CRUSE is not yet being used in clinical trials, at least not in trials where new medications are being developed. But that is an option, and we can certainly think with our partners about doing that. What CRUSE is being used for, though, and this is equally important, is clinical research. We have so many questions to answer for our patients. How long will the disease last? We don't really know. How likely is it that I will have angioedema? We don't really know. But we can capture all of this with CRUSE. In many patients, you've heard that there are already more than 1,000 patients who use CRUSE. So now we can ask questions in clinical projects, in research, and patients can help us to provide the answers to the questions that we have with these research projects. This really wasn't our primary intention. Our primary intention is to make something that helps you as patients to measure and take control. But now we see that many more things are possible with CRUSE, and we're certainly looking forward to developing the opportunities that CRUSE holds further, both for you, for your daily life as patients, but as well as for urticaria research and clinical trials.
Amazing. And Sophia, you have told us about the future, what it holds in terms of digital health and how it will change, a personalized and public healthcare sector. What do you suspect the future is holding for CRUSE and for urticaria patients? How do you see the development of it? What are the possibilities of it in the future? What would you say?
Yeah. So first of all, what we're already working on, we want to bring CRUSE to every chronic spontaneous urticaria patient worldwide. And so we've got this worldwide English version, just to point it out again. But then we're working on that every country gets a version with in their language and with their local medication. So that's the first step. Then what we're currently working on, we want to put more educational material, more information on the app so that you as a patient understand what is really urticaria, where does it come from, why do I have it? So that's going to be step 2. And then some way in the future, I haven't really, I think, talked about it with the team, but connected to telemedicine. So in the app at some point, so have an appointment with Marcus, and then in the app you'll just click on it, and there you will have your physician. Yeah. So all in one. I think that's the future. What maybe where we're going with CRUSE, and we're on a good way.
This would be so cool, Sophia. I really like that vision. And Herman just posted, thank you, Herman, for your suggestion, that there's also technological ways of moving forward. No voice interface. Will it be possible to talk to CRUSE so that you no longer need to enter the data, but you can just communicate your scores? Is it possible to link it to a wearable that maybe measures how often you scratch or what your itchingness is like? I think there's many things that when smart people put their heads together, and we need you as patients to share your smartness with us, then we can make that app even better, easier, and more valuable to move forward.
For sure. And what would be your final thoughts, suggestions, or wishes for your patients in terms of digital health and implementing new tools in their life? I believe it's sometimes scary to try things out, to share sensitive information with the things you might not necessarily understand completely to its core as healthcare apps. Those are completely new and changing. So what would be your suggestion, wish, final remarks?
I'll go first, and then Sophia, you can top it up. So my suggestion, my wish is, dear patients, use CRUSE. You're doing yourself a big favor. You're doing us a little favor, but yourself the bigger favor, and you're taking control of your disease. Don't be afraid. Also, not of the time that it takes. It's time that's well invested, that will pay off in the end in a faster path to good treatment, a faster path to medication and advice that will help you get your disease under control. So download it, spread the word, work with patient organization, advocacy groups, and your physicians so that everyone knows about this opportunity, because it doesn't do much good sitting in the App Store. It needs to be on your phone. It needs to be at your fingertip in order for CRUSE to help you, help us.
Yeah, I would say just implement it as part in your daily life after toothbrushing. Just fill out this questionnaire. It's 1 minute. That's it. You might think, how does it help me to fill out those questions in that moment? But at some point, you will see your improvement if your therapy works. If not, you have to see your urticariologist again. So just let it be part of your day. It's just 1 minute, and it will be a good tool for you to see how you improve and how your quality of life gets better.
For sure. And from the patient side, don't be afraid sometimes to show something new and something good to your physician if they are not yet aware of that. And try these new things out. It does not hurt. It might help you a lot, and consistency definitely pays off. And on this note, I want to thank you, our lovely panelists. I want to thank our participants of today. And also thank you, our sponsors, for having opportunity to run these webinars. And thank you, wishing you a nice day. And thank you once again.
Thank you.
Thank you.